Hi, everyone. Dr. Martin here. And I want to tell you about a discussion I had in class the other day. So, we were talking about digestion, and that led to digestive disorders, which led to the treatment of digestive disorders. And with our discussion of digestive disorders, we started talking about gastroesophageal reflux disease, also known as GERD. Now, one of the primary ways that GERD is treated is by using a proton pump inhibitor. So our proton pump inhibitors are things like Nexium, Dexilant, Prilosec, and Prevacid. Now, these aren't all the proton pump inhibitors, but these are some of the ones that are more commonly used. All right, anyway, so our discussion of the proton pump inhibitor use led to what are the possible adverse effects and complications? Well, one of the complications that's been shown in the research lately is the development of osteopenia, osteoporosis, and an increased risk of a bone fracture. And so the question is, well, why would that potentially happen? Why would using a proton pump inhibitor possibly lead to an increased risk of a bone fracture? Well, the answer to that may reside in the fact that proton pump inhibitors have been shown in the research to lower the levels of vitamin B12, vitamin C, magnesium, and calcium. So, if we talk about vitamin B12, we associate that with predominantly with energy, but it's also going to be an antioxidant. It helps to get rid of homocysteine. Now, higher levels of homocysteine are associated more with things like cardiovascular disease, but high levels of homocysteine can also cause issues with endometriosis. So, could they possibly impact the bone? Maybe. It's a bit of a stretch, but we do know that inflammation in the body can possibly contribute to an increased risk of osteopenia, osteoporosis. So I know it's a bit of a stretch, but I'm going to go there. Whatever. So anyway, vitamin B12 maybe theoretically could have an increased, or lower levels could have an increased risk of a bone fracture. Vitamin C. Well, vitamin C is an antioxidant, again, helping with inflammation, helping with free radicals. So again, we could go back to what we were talking about with vitamin B12, but again, that was a bit of a stretch. So we're going to go somewhere else. Well, vitamin C is also used for the formation of collagen. Collagen is found in the bone. So maybe lower levels of vitamin C could possibly lead to osteopenia, osteoporosis. Now, again, we're not to the point where the individual is developing scurvy because they're taking a proton pump inhibitor. That's not happening. But they may have lower levels than would be considered optimal. If we go to calcium, that would make the most sense. But the biggest issue we have here is that some of the studies show that proton pump inhibitors impede the absorption of calcium, and some show that they have no effect on calcium levels in the body. So it's back and forth. So we really don't know as far as the research is concerned. But because 99% of calcium is found in the bones, it would make sense that lowering the levels of calcium could possibly increase the risk of osteopenia and osteoporosis. The biggest one, and the one that's probably responsible for our increased risk of bone fractures, is lowering the levels of magnesium. Now, magnesium, about 60% of magnesium in the body is found in bone, and proton pump inhibitors have definitely been shown to lower the levels of magnesium. So the whole thing is that, yes, this could be definitely the reason that we see an increased risk of bone fractures is because of lowering of magnesium. Now, magnesium also helps to regulate calcium channels. So maybe lowering the levels of magnesium and interfering with calcium channel regulation could put us at an increased risk of osteopenia, osteoporosis, or bone fractures. We also have to consider the fact that a majority of people in our society have low levels of magnesium in their diet. And so it's estimated that about 50% of people in the United States are at an increased risk of magnesium deficiency. And that's because the primary foods that have magnesium are things like spinach and things like seafood, shellfish. How often do you see people eating a lot of shellfish and a lot of spinach? So anyway, so we were talking about this in class, and one of the students said, well, I'm taking a proton pump inhibitor. I'm taking Nexium. What should I do? Well, the answer to that is not necessarily stop taking the proton pump inhibitor. Of course, I like to try to work with patients to try to help them to improve their diet and things like that to get to the point where they could potentially use the proton pump inhibitor as needed rather than using it every single day, right? Because the question is, well, when do I stop using this every single day? The answer is, basically either when you die, or if you can improve your digestive function, right? And so there's not really an endpoint that people give you when they prescribe a proton pump inhibitor. So the whole thing is, well, take the proton pump inhibitor. There are things you can do to help you to improve your diet and then improve your, or to reduce your risk of having symptoms of GERD and things like that. But also at the same time, make sure that you're supplementing with calcium, magnesium. I recommend a B complex, because then that way you get all the B vitamins, not just B12, but you might also consider taking a B12 by itself and then vitamin C. All right, hopefully you found that helpful. I hope you guys have a wonderful rest of the day.